Good morning, everyone. Today is Tuesday, July 8th, 2025. I'm Eric Feaster, Professional Development Coordinator for the Southern Maryland Regional Office, Maryland Department of Health, Developmental Disabilities Administration. Before we begin, we want to ensure civility for all meetings. The free expression of diverse viewpoints is a fundamental value of our group. This freedom carries the responsibility to engage respectfully, which means treating one another with dignity and respect in good faith. Uncivil behavior, disruptive conduct, abusive language, threats, or harassment will not be tolerated and may lead to being excused from the meeting. Thank you for helping to keep this productive and comfortable for everyone. If you would like to use closed captioning so you can read what is being said, click this button. Sometimes the transcription is not exact, but it's pretty close. Today's presentation is available in the handout section. Click here where you see the paper clip to download the presentation slide deck. The webinar is also being recorded and will be made available tomorrow on the DDA YouTube channel under the DDA Medicaid Waiver Amendments 2025 playlist. And the presentation slides and webinar recordings will be available on the DDA Waiver Program website tomorrow as well. All attendees are currently in listen-only mode, and your mics and cameras are turned off. If you have a question you would like us to read and answer, click here where you see the question mark to add your question. And now I'd like to turn the mic over to our Director of the Southern Region, Anesta Duke.
Thank you, Eric. Good morning, everyone, and welcome to the Southern Maryland Regional Office Quarterly Provider Meeting. Today's agenda includes an update from our Quality Improvement Organization, Liberty Healthcare Corporation, statewide provider services updates. We will also have a presentation by ICI regarding employment data and where we are in Maryland, as well as regional office updates. At this time, I would like to introduce Christina Dixon, the Executive Director of Liberty Healthcare Corporation, to provide an update on person-centered excellence evaluation activities. Good morning, Christina.
Good morning, and thank you so much for having us this morning. We're excited to see you all again. We do have an update on person-centered excellence evaluation activities for you today. And you can go to the next slide, please. So we're going to kick off today's meeting with some information and resource sharing with you related to system quality and participant outcomes. So we're looking at to what degree are systems and practices in place that support person-centered excellence within Maryland. And I think most of you know that this data comes from the Council on Quality and Leadership's basic assurance reviews that we at Liberty conduct with you all, and personal outcome measure interviews that we conduct with the people that you support. Next slide, please. That is a slide further along. Can we go back to the slide titled, "Can Volunteers Help to Create Natural Support Networks?"
Is there? .10.
Yep, right there. Thank you. Okay. So this is actually national data from the Personal Outcome Measure interviews. And what we're going to look at today is, can volunteers help to create natural support networks? So as I mentioned, this is national data. And so this slide contains data from the Council on Quality and Leadership, or you might know them as CQL, and shows for each area of a person's life, how much more likely is it to be present for people when they have natural supports in place. And just as a reminder, natural supports are defined as those key people in a person's life, usually family or friends that are close to them, and that are in someone's life for an extended period of time. And so, as we aim to help people build relationships and achieve a greater level of community integration, volunteers can be used to build capacity for natural supports or break down barriers, creating strong community connections. So, why is this important? The data on the slide, again, collected nationally through the Personal Outcome Measure interview, does show a relationship between natural support networks and quality of life outcomes, but it's not always easy to help people grow their own networks, and we should consider if volunteers can assist with this. So a little bit of Maryland's data for you. Of 89 provider organizations who have participated in a basic assurances review so far, only 21% of those providers engaged volunteers to build capacity for natural supports at the time that we conducted the review with them. However, many of you who we spoke with told us that you had in the past engaged volunteers or a volunteer program within your organization prior to the COVID-19 pandemic, and that those programs had paused and may not have been resumed following the pandemic. So maybe you already had systems within your organization that you used in the past. And one of the things that you could consider is reviving those. If you did revive them, could you identify volunteers who naturally have skill sets in networking? Or how could you leverage this skill or any others to promote outcomes of people you support? And we did want to share one Maryland spotlight. So a provider in Maryland is doing a lot with volunteers, the League for People with Disabilities. They have a comprehensive volunteer initiative. And one of the things that they do that was really interesting is they have a volunteer interest form that's available directly on their website. It's monitored regularly and has helped them to develop a robust volunteer orientation for the people that come into their organization. And the League connects individual volunteers, many corporate volunteer groups, and other networks as part of their program. And they also celebrate the impact volunteers have with newsletters, social media posts, and special communications. Next slide, please. And if you would like to check out the full article where the data from the last slide came from, you can use this link here to navigate to the Council on Quality and Leadership's website. Next slide, please. Thank you. And so next we are going to take a look at participant and family voice, which is collected through the National Core Indicator participant and family surveys, and it tells us to what degree are participants experiencing quality services and supports in Maryland. Next slide, please. So using participant feedback to fuel volunteer engagement. So the data on this slide shows that 60% of people responded that they wanted help to keep in contact with friends. And in a past presentation, we spotlighted Gallagher's natural support identifier form that they generously allowed us to share with you all. If your organization uses that form or another way to identify who, how, and the desired frequency a person wants to connect with others, could you think about how volunteers could then work individually with people to help them connect or reconnect with the people identified that are important to them? Or are there volunteers that have skill sets to help find alternative ways to connect with important people when someone can't see them in person? One aspect that we did love about the League's volunteer interest form is that it helps to identify skill sets and interests a volunteer applicant had so that they can then match them with tasks or people they'll be most impactful with that the organization is supporting. And I mentioned Gallagher's natural support identifier form as a resource for planning. Like I said, they've given us permission to share this resource. So if you'd like a copy and don't currently have one, feel free to send me an email and I'll make sure that we get that over to you. Next slide, please. So we have been taking an opportunity at each of the meetings with you all to share the data at a glance documents for the different national core indicator surveys that Maryland has conducted. And so on the next slide, you will see a snapshot of the data at a glance document for the Family Guardian National Core Indicator Survey. Next slide, please. Thank you. So last time we met, we shared the family survey responses from those families who live with a loved one in the same home. Today, we're sharing responses from families who don't live with their loved one. So we hope this information will be particularly of interest to a lot of you all on this call as providers who support people to live residentially, because respondents of this particular survey are primarily people who live and are supported by your services. And one thing that I did want to note, as you'll see down here on the bottom right-hand corner of the graphic, 74% of the people who participated in this survey do live in a group home. And so again, most of the respondents are probably connected to you all. And if you would like to use this data at a glance document to share information with those interested in knowing, it's available on DDA's website. And you can also access the full, more detailed report for your information, which is available on the link on the slide. Next slide, please. And why is it important for people to participate and what happens with the information? So National Core Indicator reports and data help to achieve various goals, including enhancing practice in Maryland, influencing public policy, informing strategic planning, and contributing to scientific literature. And one of the things that I wanted to highlight that you'll see on this page of the data at a glance, I think is especially important for you all to know is that 89% of the families who responded to this survey did indicate that services and supports help their family member live a good life. And that's just a testament to all of the work that you and your teams are doing. And so I hope that you'll share this information with your teams and also with people and families and other stakeholders within your organization. And again, the two-page data at a glance document is available on DDA's website at the National Core Indicators link. Next slide, please. And we are going to take a look at a little bit more detailed information from the two family surveys and look at how do living arrangements shape services and family perspective. And as I mentioned before, we do conduct two different family surveys, one for families whose loved one lives in the home with them and one for families whose loved one lives outside of the home. And so that's the comparison data that we're going to share with you today. Next slide, please. So I'm looking for the slide titled Home versus Residential, How Living Arrangements Shape Services. Oh, that's it. Yep, thank you. Okay, so this slide shows us how living arrangements shape services that people receive. People who live outside of a family home, so someone who may live in a group home or in their own home or apartment, are more likely to need day and or employment supports. So 72% versus 55% for those that live with their family. They're also more likely to need support for transportation, so 91% versus 57%. They are more likely to need mental health or behavioral care services, so 58% versus 30%, and they are less likely to self-direct their supports, and that's 15 versus 41%, as you see here on the screen. Next slide, please. So it is 17% more likely for people living residentially to have a mood or psychiatric diagnosis. And this is important information for us to know because it signifies the importance of provider competencies and staff competencies in quality medical, communication, and behavior systems and practices within an organization. Next slide, please. So this slide shows us families whose loved one lives residentially indicate less satisfaction with staff turnover, so 55% compared to 45%. And potential factors are that families are more involved when someone lives in the family home rather than separate from them, and that they support staff retention, or that families who do not live with their loved ones are not always aware of when staff change. We don't have the exact cause of that. More research would need to be done to determine that. Next slide, please. Families whose loved one lives residentially indicate less satisfaction with feeling their choices and opinions were heard by coordinators of community service, so 50% versus 65%. And then potential factors are that families whose loved one does not live with them may not be included in the planning and monitoring processes, or there are other team members influencing the plan. And again, additional research would be needed to explore those causes. But one thing that you all and your teams can do is encourage CCSs and the people that you're supporting to advocate that families participate in the way that the person would like during the planning process. Next slide, please. And then lastly, for the National Core Indicators data, we do see that families whose loved one lives residentially express less choice of coordinators of community service, or their CCSs, which is 24% versus 38%, and less choice of their direct support professionals, so 24% versus 57%. And during April's provider meeting, I'm not sure if everyone was logged on, but we did share some resources on how to engage people supported to have choice and provide feedback on their staff. And if you weren't on that meeting and would like any of those resources, feel free to reach out to me. I'd be happy to send those over to you. Next slide, please. And then next today, oh, I'm sorry, we should be, yep, right there, thank you. So next today, we're going to look at system compliance and to what degree are DDA standards being met. And the reviews that give us information for this are qualified provider reviews, claim reviews, critical incidents, restraint investigation reviews, level of care, and person-centered plan reviews. Next slide, please. See, so should be at the slide that says greater than 85% in a green box meets or exceeds compliance.
Christina?
Yeah, do you all not have that slide? I believe the group's pretty familiar with that information, and so we can include that in the slide deck if you all were sharing that after the meeting. Do you have the slide that says self-directed services review updates? We're all checking for the self-directed services review update slide. I can start going over some of that information just verbally with the group. So we did want to share some updates on the self-directed review. Yes.
Christina, we don't have that slide. Are you able to just share the information?
Yep, I'll just verbally go over the information and then can make sure that you all have that following the meeting to
Thank
send
you.
out to the group. Sure, thank you for checking. So self-directed services review updates. We are updating that review and we'll start reviewing based on those updates in August. That will be for claims from January 2025. And reviews conducted will have the following requirements to ensure compliance with program requirements. So the review will look at service note documentation, documentation for employer-related costs. We'll look to verify training records of staff. It will include updated guidance from the self-directed policy and manual. There will be corrective action plans associated with the review and participant interviews associated with the review. We're currently piloting that review for a go live date in August or go live date for the revisions in August and look forward to working with all of you around that. And then lastly, or towards the end of our slide deck, I did want to share, many of you may have noticed that you did not receive information requesting documentation for claims in the beginning of this month. That is because at the request of DDA to provide data on more recent claims, provider training, qualification, person-centered plans, level of care assessments. Liberty will be shifting its quarterly review process by 1 month's time. So usually you would have seen requests for documentation from us in the beginning of July. You'll now be receiving that in the beginning of August. And we do have a table that we will include in the slide deck that's shared with SMRO so that you can see the schedule for the review periods and how they have changed. But again, that's just been pushed back 1 month for each quarter and will continue on that schedule going forward. And then lastly, I will put in the chat, as many of you know, we do have a feedback survey for the reviews that we conduct. And so we really appreciate when you all do provide feedback to let us know what your experience was like and how we can improve those reviews. In the slide deck that'll go out, there is a QR code that can be scanned to provide a response. And as I mentioned, I will try to drop a link in the chat here. Any questions for today?
Yes, Christina. The first question is, what was the overall response rate to this survey?
For the National Core Indicators Participant Survey, the data that we shared today, there were 533 participants receiving services in Maryland who responded. And for the family responses of those whose loved one lived outside of the family home, there were just over 400, I think it was around about 450 family responses. And of families whose loved one lives at home with them, there were about 700 families represented in that comparison data that we shared. Any other questions for today?
Yes, the next one is, if you could repeat the information you shared regarding the volunteer organization?
Let's see. So I shared information about the League for People with Disabilities so they're an organization in Maryland that has a comprehensive volunteer initiative, making a volunteer interest form available on their website so that people can apply directly there and they can match skills and interests with those people that they're supporting within their program. And then also shared information that Gallagher Services has a natural supports identifier tool that they've given permission to share that helps to identify natural supports, and that can be used to help match volunteers within an organization. Any other questions?
No, that was all.
Okay, well, thank you all so much. Appreciate you having us today and look forward to the rest of the meeting.
Thank you, Christina. Okay, so our next presenter is John Butterworth and Stacy Jones, and they are from the Institute for Community Inclusion, and they're here to discuss employment data and where we are in Maryland. Good morning, John and Stacy.
Good morning, and thanks so much. John Shepard will also be presenting with us, and is the primary contact for those of you who are meaningful day providers that are involved in reporting on the data collection. So I just want to make sure we acknowledge him. If you could go to our first slide. I'll just take this one for a moment to say we're all affiliated with the Institute for Community Inclusion based at University of Massachusetts, Boston, but have had a working relationship with Maryland around improving employment policy and employment services, starting as part of your membership in the State Employment Leadership Network, a community collaboration of currently about 26 state IDD agencies nationally that share strategy and lessons learned. If you could go to the next slide. But we have a specific data and training and technical assistance project that's currently running. We're going to be focusing on the data collection, the Employment and Meaningful Day Information System. Today, we want to take a little time to share what we're learning, what the most recent data reporting looks like, give you a quick update on the May data collection cycle, which some of you are completing. But the other parts of that are a couple of training initiatives, one providing access to a hybrid online as well as personal contact, though remote, ACRE training for employment specialists. We're running cohorts that involve online use of modules from the College of Employment Services, opportunities to gather together as a learning community to talk about what people are learning, completion of the practical work that's required for ACRE certification, and then individual follow-up contact to support implementation of the learning by each of the participants in the training. We currently have a summer cohort in process with 30 people participating. I think our fall winter cohort is possibly already full, but we'll be reaching out again in the fall about access to that. And we'll have at least one more cohort following that in a winter spring timeframe. And then the second part of our training work is working with CCSs around strengthening the conversation they have about employment and understanding the employment process as they support participants in developing their person-centered plan. We're currently recruiting for that and getting ready to run a first cohort of that particular training. And finally, we're currently working with about 12 organizations doing customized on-demand support around improving both employment and community life engagement outcomes. And there's a learning community also attached to that. You can reach out to Stacy or I about the training and the technical assistance. Currently we're full, but as available, we'll be making more options available for engaging in that as we move into the fall. So that's just a quick overview of the package, but we mostly want to talk about the data, and I'm going to hand off to John Shepard to get us started on looking at where the data is. So if we could go to the next slide, please. And John, are you connected as a presenter? There you go.
Yeah, can you hear me?
Yep.
Okay. So I think this slide and possibly the next one, if you could just skip 2 ahead, I think this should be at the end. We can either return to them or I can review it at the end. Yes, the next slide, if you don't mind. Thank you. Okay, that's good. So hi, everyone. My name is John Shepard. As John Butterworth mentioned, I'm a research associate at the Institute for Community Inclusion at UMass Boston. And I support the DDA and am the main contact for the Maryland DDA Employment Outcomes and Meaningful Day Information System. Today, I wanted to give a quick review of the purpose and goals of the information system, review the data that providers are expected to enter into the information system, and share with you some recent data trends from the last few years, and then give just a quick update of the status of the current data collection reporting period. So this slide just gives some background in case you're less familiar with the project. The DDA Employment Outcomes and Meaningful Day Information System was established in 2013 the purpose of meeting the DDA and its community of stakeholders' goals of Maryland's position statement on employment services. To do this, ICI collects, analyzes, and reports on longitudinal data with the goal of improving participation in integrated employment and the quality of employment outcomes. The data is then compiled each reporting period into tailored reports for the DDA and included as well on a data display website where you can view data summaries of providers across Maryland. Our data collection system ensures that the DDA has accurate and up-to-date information on employment and day service trends, and it also ensures that families and individuals can make informed choices about services. Next slide. So to help meet these goals, the project requires that every Maryland provider enter data for each person who receives DDA-funded meaningful day services. Data for these individuals is entered twice a year, once in May, once in October. Each organization can choose any 2-week period within the reporting period month so that the data is entered for each individual in a 2-week snapshot of employment and day participation during that month. So each provider can customize what that 2-week period is for their data. Next slide. On this slide is a list of the specific activities that we collect data on. So for each individual, we ask that providers indicate whether an individual participated in individual competitive jobs, an individual contracted job, group integrated, self-employment, facility-based jobs, community-based non-work or community engagement, and facility-based non-work or program-based activities. And then additional data required for each individual when it's applicable to the activity include the total hours worked, the gross wages earned across the 2 weeks, whether the individual received paid time off, whether the work is a set-aside contract, and whether the individual also participated in volunteering in terms of community engagement. We can go to the next slide. So next I'm going to go through a few slides that share the current data from the most recent reporting period, as well as some trends over time. And this slide summarizes employment data specifically from the most recent finalized reporting period, which was in the fall, October of 2024. So in October 2024, the data show that everyone reported 2,776 or 33% of individuals were working for pay. And out of these individuals, 13% worked full-time. From the spring to the fall, the average wages in competitive integrated employment increased from $637 in the spring to $650 in the fall, and the average hours worked remained consistent across the past 4 years. Compared to 2019, before the COVID pandemic, the percentage of individuals in competitive jobs increased from 23% to 28%, and the average wages increased from $430 to $650 in 2 weeks, while the average hours worked in a week remained pretty steady, around 37 to 38 hours during this period. You can go to the next slide. Thanks. I think something might have happened with this slide. It had some more detailed information, but I can give you a summary. So actually, sorry, could you possibly find the slide that is very similar to the last one we're in? It is titled October 2024 Data Snapshot of Non-Work. Thank you. So this slide is similar to the last one, but it summarizes non-work activities for October. So 4,351 individuals participated in community-based activities, or 52%. Out of everyone reported, about 17% engaged in volunteering, and 44% participated in facility-based activities. Since 2019, we've seen a drop in the total number of individuals reported in community-based activities, but a higher percent of the total amount reported has participated. So that percentage has gone up. The average hours spent in these activities has increased from 23 to 28, and the number engaged in volunteering from 2019 has decreased from 23% to 17%. And we can go back to the slide we were just on. Like I said, this had some more detailed numbers here, but I can just give a summary. So this figure, it shows a trend, the trends in participation. The line should indicate that there are individual competitive jobs, individual contracted, group jobs, and community engagement. So in summary, this is a showing trend lines from 2019 to 2024, and the percentage of individuals in competitive jobs rose from 23% to 28%, which showed a pretty strong rebounding growth following that dip that you can all see in 2020. Community engagement saw the most notable increase, climbing steadily from 46% in 2019 to 52% in 2024. Despite a similar sharp decline in 2020, while group integrated and individual contracted jobs remained relatively stable and low. Those are the two bottom lines that are shown throughout this period. And I believe you could skip ahead 2 slides, or that's good. Sorry, thank you. So this is a similar slide. It shows the trends in hours spent from 2019 to 2024 in work and non-work activities. During this time period, average hours per week in community engagement rose from 23 to 28, while average hours in individual competitive and contracted jobs remained fairly steady, hovering around 40 to 42 hours, and group integrated job hours showed a modest increase from 31 to 39 over that same period. Next slide. So this table, it shows that many individuals participating in employment also participate in community-based and facility-based non-work. And the table shows the number of individuals who participated in both activities, so certain job categories, as well as community-based or facility-based non-work. In summary, among those in competitive jobs, 22% also participated in community-based non-work and 15% in facility-based non-work. Participation in non-work services was even higher among those in sheltered employment, with 42% also in community-based non-work and 62% in facility-based non-work. Notably, over half of individuals who were self-employed also participated in community-based non-work and facility-based non-work services. Next slide. I'm sorry, could you circle back to the first 2 slides that were here? Should be the regional table. Will be a table, slide titled Regional Breakdown is at the very beginning. So 2 before this one, I think. Great, thank you. So we also are able to break down service participation by region. What this table shows, I know there's a lot of numbers, but in summary, it indicates the range of participation as it differs across the 4 Maryland regions. So what we see here is that the percent participating in any integrated job ranges across these 4 regions from 20% in Eastern Shore to 36% in Central Maryland, with the majority of individuals participating in individual competitive jobs in each region. We also see that participation in community-based non-work ranges from 44% in Central Maryland to 69% in Eastern Shore. Then we can go to the very next slide again. So this is a summary of the current reporting period, which is, so all providers are currently reporting on May of this year, May 2025, and that spans May 1st to May 31st, with the deadline coming up for July 15th. Right now we have 202 providers on our list. 63 have currently completed entering their data, with another 29 who are in progress or have started entering their data. Out of an estimated 9,251 individual records in the database currently, about 5660 have been completed. So that's where we are in the current reporting period, and that is all I have for data and updates. Let me know if you have any questions and if I missed anything, John.
Sure. I'll just mention maybe quickly a couple of things. One is it's just important to note that the data John reviewed, and if you're a meaningful day provider, you hopefully know this, it's focused on the actual activities people are engaged in, not the services they're receiving. So what we're trying to capture is, what did people do? What was the outcome? I think the trends are also really important. Maryland continues to be a relatively high performer in terms of particularly employment outcomes compared to other states around the country, and the upward trend in both participation in competitive integrated employment and in community life engagement is a real strength of the direction, and part of what this data system is intended to capture as priorities for the state. This was a short overview of the data. We're happy to come back and do a kind of a deeper dive and exploration of the data if that's useful, but also just wanted to make sure people had a chance to see what you were reporting to. You can also see that online and explore the data yourself. I don't know if it's possible to post this in a chat, but the website is statedata.thinkwork, all one word, .org/MDDA. Or you can just kind of Google the title of this presentation and you'll probably come up with it. But you can look at the data by state, region, provider, filter by age, and some other filters. But you can explore pretty thoroughly there, as well as we're happy to answer questions. And John is the premier contact for practical questions and also questions about the data. So happy to take any questions.
Okay, we have a few questions. The first one, does ICI feedback information to DDA about their findings, such as what they are supporting providers in increasing capacity to provide CIE?
That's really, Stacy could probably comment on this as well, but that's a big part of our work with Maryland as a member of the State Employment Leadership Network is addressing some of the larger policy issues, and part of what we learn from our work directly with the providers that are part of the Technical Assistance Initiative is things that are stumbling blocks and things we can bring back to the state. So yes, we do. Both the concrete data and outcomes, as well as talking about what we're learning about implementation.
Okay, next question. What does the future look like for ICI with all of the changes at the federal level?
Oh, that's a hard-hitting question. I mean, ICI has been had a strong focus on employment and more recently community life engagement for a long time. We certainly expect that to continue. It is a rough period where parts of our funding, we have a very diversified funding base, but parts of it come from the part of the federal government that supports the national network of university centers of excellence in developmental disabilities, and there is some risk to those funding sources. So And I think all of us are wondering what'll happen with the pending impact on things like Medicaid. So that's a more complex question than I think I can probably get into today, um, but I don't expect that we'll stop doing what we're doing here.
Okay, the next question, can you explain what is meant by community-based non-work versus facility-based non-work?
John, do you want to take that?
I feel like you could give like some more pressing detail to round it out, if you don't mind.
Sure. Me, you mean?
Yeah.
Sure. Um, I mean, technically in our data collection, we define that as time spent in the community, not in a program setting. So that's the core piece that we're collecting in our data. You could also call that community engagement or community life engagement. But it also relates to the distinction between kind of the program you're in, like community-based day, and what you're actually doing in any moment in time. And what we're hoping to collect is the amount of time people actually spend in the community as the core data piece there.
Okay. There's another question. I'm not sure if this one is for you, but I'll ask it. When will MDH/DDA provide analysis and guidance on how the recently passed Republican reconciliation bill will impact Maryland Medicaid and DDA services? We'll take that back and provide a response for you.
Yes.
And that was all the questions. Thank you.
Okay.
Okay, thank you, ICI team. We really appreciate your presentation and all the information you shared. Thank you.
Thank you so much.
Okay. All right, so now we'll begin our statewide provider services updates. Next slide. All right, just some quick reminders. The deadline to complete the NCI staff State of the Workforce Survey has been extended to July 31st, 2025. So please complete the survey if you have not done so already. As a reminder, the State of the Workforce Survey is the required document that you must complete and submit to meet the requirement, which states that providers shall submit a wage survey 60 days after the last day of the pay period for which the data is requested, or 60 days after receipt of a request from the administration for wage survey information. If you have any questions or have not received the survey link, please contact Kiana Blakeney at kiana.blakeney@maryland.gov, and she'll be able to assist you with obtaining any necessary information in order to complete the survey. Next slide. Okay, just some quick reminders regarding our new relocation process. As stated in COMAR, the DDA must be notified of any site opening, closing, and relocation at least 30 days prior to making the change. Effective July 1st, 2025, DDA has implemented a new process to notify the regional office of any relocations planned and/or for emergency purposes. Please review the new guidance and ensure that you submit the relocation and any applicable updates via the participant's relocation form, which is linked here. Effective immediately, the use of Airbnbs as a residence for traditional program participants is not permitted. And information can also be found on our website within our provider resources tab to learn a little bit more about our new relocation process. Next slide. A few reminders regarding staff training. At this time, on May 8th, 2025, we inform providers that the requirement for the following employment services training has been paused. These trainings are basics of employment first, basics of customized employment, facilitation of natural supports and principles of fading, the role of the job coach, basics of benefits awareness, and basics of self-employment. We want to clarify that all other required trainings remain in effect and should continue as outlined in our training matrix, which is also linked here for your convenience. Next slide. So we are going to move on to region-specific updates, starting out with some staffing updates. Next slide. At this time, we have two new staff at the Southern Maryland Regional Office. Christopher Kubaska is a new member of our provider services team. And we also have Brittany Gregory, who is a new member of our eligibility and waiver team. Next slide. I am going to hand it over to Ms. Kiana to share some provider services updates that is specific to our region.
Thank you. The first reminder I would like to share is regarding site capacity increases. If you need to increase the capacity of a licensed site, you must send a completed site addendum to myself and the Office of Healthcare Quality. The provider services team will conduct an inspection to ensure that the site is in compliance with the community settings rule. And then the Office of Healthcare Quality will conduct an inspection to ensure that the site still meets all applicable COMAR requirements. And then again, prior to submitting any site addendums, please make sure that each site meets COMAR requirements and that all required reports, so fire marshal, occupancy permits or lead reports have been completed to avoid delays. And then also please remember that community living group home capacity cannot exceed 4. Next slide, please. And I would like to share some LTSS Maryland reminders. Please make sure that you double check the service address and verify that there are no end dates associated with services before you accept the service referral. This would help avoid any billing gaps or any billing issues. The next thing, if you did not receive service referrals for new sites, please make sure that the admin provider for your agency grants you access to the site by assigning the site location to your staff profile. Again, only the person for your agency who has an admin provider role in LTSS will be able to grant you access to any site locations in the provider portal. And then lastly, if you are experiencing any technical PCP issues or billing exceptions for Southern Region participants, please send an email to ltssinquiries.smro@maryland.gov for a timely resolution. Next slide.
Okay. Well, just moving on to some basic PCP reminders. Just to let you guys know, the SMRO plan reviewer team reviews approximately 3,000 person-centered plans each month. So they are very, very busy. A significant number of these plans are returned for additional clarification and additional documentation. To ensure efficiency, teams should work collaboratively to address these clarifications within 5 business days. Some plans may require new service referral acceptances from DDA providers, and these requests should be reviewed within 3 days. Next slide. New or increased services should not be initiated prior to the PCP authorization process. The regional office plan reviewer team will continue to prioritize the review of urgent plans for people who need access to new or increased services. In urgent situations, the person-centered plan details section should include an option to indicate whether the person-centered plan needs to be reviewed within 10 business days of submission due to a significant issue or change in the participant needs, such as beginning a new job, supports needed after surgery, and so on and so forth. In these situations, the CCS will select yes next to the urgent option to indicate that DDA's review of the person-centered plan needs to be expedited. Next slide, please. Some additional person-centered plan reminders. The implementation of services for participants actively enrolled in a waiver program can occur once the person-centered plan is authorized, and services can begin based on the PCP's effective date. PCP-related inquiries specific to service authorization and clarification requests should be directed to the assigned reviewer, or providers, if you have questions, feel free to reach out to Carrie Wargo, and her information is noted here. And you also have the option to reach out to Michael Bryan in order to get some additional assistance regarding PCPs. Next slide. Here are just some updated guidance specific to person-centered plans that you should be utilizing just to gain a better understanding of our service authorization criteria, our guidelines. We also included the person-centered planning manual, as well as the service authorization and provider billing documentation document. So feel free to continue to access these resources as they will provide a good understanding of the PCP process. Next slide. And I'm going to turn it over to Ms. Julia to give us an update regarding QE, quality enhancement.
Thank you, Onesta. So this first slide is just a reminder, which was previously mentioned, of the new relocation process. And it entails submitting a participant relocation form as means of reporting relocations. This process will standardize reporting and tracking of relocations across regions and improve DDA's and OHCQ's access to information to ensure the health and safety of people we serve, prevent service interruptions, confirm consent of relocation, and ensure that we at the regional office are aware of everyone's whereabouts during a relocation. So please be sure to review the new relocation guidance on our DDA website. And we would like to thank all agencies that notify the regional office of temporary service relocations in a consistent and timely manner. Next slide. I'm going to briefly talk about some incident data. So here at the Southern Maryland Regional Office, we serve 7,613 people, with a breakdown of 6,283 people in traditional services and 1,330 people in self-directed services. And we currently have a total of 178 providers in our region. And the chart you see here on this slide displays incident data for our region and includes Type 1 incidents for quarter 1 through 3 in fiscal year FY 25. Quarter 4 is not included as that quarter just ended, and that data is currently being finalized for accuracy. The chart also breaks down the number of type 1 incidents per quarter, and as you see, hospital admissions were the highest incident type for all 3 quarters, followed by abuse and neglect. And also, majority of the incidents fluctuated throughout the 3 quarters, with the exception of choking incidents, which there were only 2 in quarter 1. Next slide. And this is just a reminder to notify the regional office of events that have the potential of becoming newsworthy. This includes any event that meets the criteria of an internally investigated incident per PORI. And receiving these notifications have allowed us to ensure the health and safety of persons served. Next slide. I'll turn it over to Desiree for eligibility.
Hello. So I wanted to review the waiver eligibility requirements. To remain eligible for their chosen Medicaid waiver program, individuals must consistently meet the medical, technical, and financial eligibility requirements. The Developmental Disabilities Administration ensures that individuals continue to meet medical and technical criteria through an annual recertification of need or level of care and the annual person-centered plan. Both are submitted by the assigned coordinator of community service. The Eligibility Determination Division, or EDD, our Medicaid partners, verifies continued compliance with financial eligibility requirements via the Medicaid redetermination process. Providers are responsible for submitting Medicaid redetermination applications on behalf of program participants when the provider is the representative payee. Coordination with the assigned CCS is important to determine the scheduled Medicaid redetermination date for all participants. Next slide, please. To submit Medicaid redetermination applications, you can use the designated inbox for the appropriate waiver. So community pathways, community supports, and family supports participants have separate inboxes where their redeterminations should be submitted. The assigned coordinator of community service should also be provided a copy of the completed redetermination application and supporting documentation so that they can upload it to LTSS and seek assistance from the regional office if necessary. Next slide. Regarding waiver, disenrollments, and re-enrollments, LTSS Maryland is the DDA's electronic data management system. It's a customized integrated care management tracking system that manages real-time medical and service information regarding Medicaid participants. If an individual is denied enrollment or disenrolled from any of the DDA-operated Medicaid waiver programs, they must be added to an LTSS Maryland waive before reapplying. In order to do that, please coordinate with the assigned CCS. Next slide, please. I thought it would be helpful to review the waiver re-enrollment process. So again, before an individual can reapply, they have to be placed on a waive. The second step is that the waiver packet and initial person-centered plan have to be completed and submitted by the CCS in LTSS Maryland. Once those are approved by the regional office, EDD has to make a financial eligibility determination. Once that is completed, the regional office will complete a form that's called the authorization to participate, which signals to EDD and Medicaid that we are ready to serve that person. EDD then will complete an overall decision form, which is what turns the waiver on or off in LTSS Maryland. And once they've completed the enrollment version of that overall decision form, the person is enrolled in a waiver in LTSS. Next slide. To contact EDD, the assigned EDD case manager is the primary point of contact for questions related to waiver enrollments or Medicaid redeterminations. The case manager's contact information is located in LTSS with the other assignments. If you're not sure, you can contact your CCS or that individual CCS. The supervisor's information is also listed on this slide. So Patrice Miller is the supervisor for the DDA unit over at EDD, and then Ms. Cornish is the lead for the unit. Next slide. And also to assist you all with determining when redeterminations are due or whether or not a person is enrolled. You can use the Eligibility Verification System, or EVS. It's a telephone inquiry system that enables healthcare providers to quickly and efficiently verify a Medicaid recipient's current eligibility status. A medical assistance, pharmacy assistance, or QMB, Qualified Medicare Beneficiary Card alone does not guarantee that a recipient is currently eligible for Medicaid benefits. You can use the EVS system or any other MDH EVS applications to quickly verify a recipient's status and then to assure that the recipient is eligible from a specific date of service. That's it. Next slide. Thank you.
Hi, good morning, everybody. Just a few reminders about fiscal. So the first one is all providers are required to submit a general ledger data collection template for FY25, and then this is due by September 30th, 2025. Next slide, please. The following announcements were included in the DDA connections dated June 27, 2025, but I want to make note of them. So this is a reminder regarding the processing of billing exceptions on DDA services. Billing and administrative providers role can resubmit most pending services that have billing exceptions. If exceptions have been pending due to eligibility and it has been reestablished, LTS Maryland will resubmit the claim up to 60 days back from the date of being reestablished. If LTS Maryland went back farther than 60 days, it could either slow down the system or crash the system. So of course we don't want that to happen. So then keep in mind that claims need to be resolved within 1 year from the date of service. Next slide, please. Disapproval of pending services that have had an exception longer than 90 days and are not actively resolved may be disapproved by MDH. Disapproved activities will be removed from the count in the actions required section on the provider portal page. You can either use the service and claim search or the services rendered report in order to find activities marked as not authorized. Next slide, please. And then re-entering and resubmitting services. In order to do this, and I know this isn't in the slide, but just to give you, a quick view. In order to do this, you can use the services render report in the report section of the provider portal. Fill in the service date from in the service date to section, copy and paste in the client's ID or MA number and hit submit. And then under the service status column, once you get the report, it will say pending. So click on the service date on the far left of the screen and it will take you to the pending claim. Click on the edit button in the lower right area. It will populate to another screen. Under the edit reason section, which is a required field, you're going to select the best option for the submission. Click on the save button. Also located on the lower right area of the screen, and your claim will be resubmitted. So be sure to review your pending exceptions, correct and resubmit or edit the claims if appropriate, and monitor the provider portal through the action required section. Next slide, please. And then the final announcement, this was also in the DDA connections. It's a reminder about the EDV app is used for both personal supports and respite 15-minute billing. The Maryland Department of Health, MDH, wants to remind you of our electronic visit verification app training sessions. They are offered twice a month from now until the end of December. If you haven't attended yet, please consider attending soon. You're welcome to attend as many times as needed, and there are no restrictions on attendance. And these last ones were announced in the DDA connections dated June 27, 2025. That's also where you would also get the registration. If you need the newsletter, just email me and I can send it to you so you can register. Next slide, please.
So let's talk about the plan of corrections that have to be completed after the Office of Healthcare Quality has visited your one of your homes and wrote a statement of deficiencies. The provider must write a plan of correction if a statement of deficiency is issued by the Office of Healthcare Quality. The provider can provide technical assistance to the provider in creating the plan of correction. For example, if you have problems and you try to write a plan of correction and it has been rejected, you feel free, and it's of a medical nature, you can feel free to contact me, John Miller, at the SMRO. The plan of correction must address all of the requirements set forth by OHCQ or it will not be accepted. Please read the letter that comes with a statement of deficiency carefully for instructions of all the components needed in a plan of correction for it to be accepted. Be sure to give that letter to your quality enhancement team and anyone else that will be assisting. Next slide, please. After the plan of correction is accepted by OHCQ, the SMRO must verify that the plan of correction has been fully implemented. So the SMRO will require the provider to submit documented evidence that the plan of correction is fully implemented. So keep this in mind when implementing the plan of correction. The provider's executive director will receive an email from the SMRO requesting that the documented evidence be sent to the SMRO staff assigned with checking to assure the POC has been fully implemented. So for example, many of you have received emails from me requesting this, and the idea is that if you submit the documented evidence that it occurred, it makes it easier for me not to have to come and do a site visit and have to make any subsequent referrals to the Office of Healthcare Quality. Next slide. Documented evidence would be documentation verifying that each step in your plan of correction was fully implemented. This includes audits, medical chart reviews, staff training, policy, procedure updates, or other measures directly related to the deficiencies cited in the SOD. And when the executive director gets that email from me, there will be a very long list of other items that you send. So that kind of helps you. Each file name should contain the tag number it's associated with in the POC. And please include a narrative that provides the citation numbers and a documentation that substantiates that the POC was fully implemented. Next slide, please. I've provided my contact information here, and in case you have any questions. Next slide, please. This chart shows, it's a summary of all the medical related reportable incidents. In the far left column, we can see that COVID-19 reportable incidents have fallen dramatically. In the second and third to right column, it can be seen that pneumonia and fractures were most frequent. And this has been the case since we started doing this 4 years ago. So be sure to immunize for COVID, influenza, RSV, and pneumonia according to the primary care physician's recommendations. Please also be sure that staff always assist participants with walking, transferring, and bathing. Make the participants' home as safe as possible for ambulation by removing tripping hazards and avoiding stairs. Many participants also get sepsis, which is an advanced stage of an infection. Early detection is key to avoiding fatality from sepsis. Please be sure staff report to delegating nurse when someone deviates from their baseline. If the participants are seen early at a higher level of care in an illness, hospitalizations and long nursing home stays are often avoided. Be sure the delegating nurse trains staff on the early signs and symptoms of disease to avoid hospitalizations and nursing home stays. Thank you very much.
So our next quarterly provider meeting will be October 14th from 10 to 12. I hope you guys can join us then. We will move on to any questions that we may have received.
Okay, the first question is regarding the relocation process. Can you clarify if people are able to vacation in and receive support in vacation rentals? So, yes, to clarify, people can vacation at Airbnbs. However, the DDA are not permitting providers to obtain Airbnbs for the purposes of residing, whether it's temporary or permanent. So participants cannot reside or live in an Airbnb on a permanent or temporary basis. The next question, is there any way that LTSS can provide a list of participants who are back in the waiver programs to providers?
The LCSS reports don't generate based on provider agencies, they generate based on CCS agencies, so you need to follow up with the coordinator.
Can I just add to that? There are some reports in the report section for your agency that it tell you who you're authorized for, and it will tell you what waiver they are in. So if, there is that report in there for your agency.
Okay.
Next question, can you elaborate on what you meant by new or increased services should not be initiated prior to the PCP authorization process?
Yes, so we want to ensure that prior to providers initiating an increase in services, for example, increase in personal support hours or increase in dedicated hours, that it is first authorized through the person-centered planning process. So you guys need to work, if a person having a need for increased services, you need to work with the assigned coordinator of community services to submit a person-centered plan, which will need to be reviewed by the regional office. And then once it's authorized, then those services should be initiated.
Next question, does this meeting count towards the 2 training requirements annually for delegated nurses?
No, it does not.
Thank you.
No.
Next.
Did they hear that response?
Just in case you guys did not hear, no, this meeting does not count towards the training requirements for the delegated nurses. Next question, can we change? Not sure, we will get back to that one. The next question, why do many people have 12/31/999 as their redetermination date in LTSS?
It's a placeholder date. LTSS doesn't always sync up correctly with the E&E system, which is EDD's system of record. So again, you need to follow up with your CCS. You can use EVS to confirm the date, since the date in LTSS may just be the placeholder date for that person.
Okay, and then the next question regarding waiver eligibility, can you please share the typical time frame for each step in the process?
Let me go back. So for wave placement, the CCS has to notify us first, and then there's an internal process for that. It's not really based on a specific time frame. Once the person is added to a wave, the CCS has 3 business days to submit the initial MA application, 10 business days to submit the PCP for review. The regional office gets 10 days to review that PCP. We have 2 days to review the waiver packet once it's submitted. EDD gets a minimum of 45 days to do the financial eligibility determination. It can be longer if documentation is missing or requested. Once they make a financial determination, we get 2 days to submit that ATP form that tells them we're ready to support that person. And then there is not necessarily a time frame for EDD to do the overall decision once the ATP is done, but we tend to follow up with them to get that step done quickly. So to recap, it's wave placement, 3 business days for the MA application to come from the CCS, 10 days for that PCP to be submitted, 10 days for the regional office to review, 2 days for us to review the waiver packet, 45 days at minimum for the financial to come back, then 2 days for us to authorize that person to participate.
Thank you. The next question for self-directed services clients, should the provider have both the approved SDS PCP and approved budget from the FMCS prior to providing services?
Well, for people in the self-directed model, if the SDS participant is working with the DDA provider as a vendor and their approved PCP and SDS budget, they can actually just work with the coordinator of community services to share any relevant information specific to the DDA provider that is supporting the person. So my recommendation would be just to reach out to the CCS in order to obtain necessary information that can be shared with the provider.
Thank you. Next question. What happens if an individual is disenrolled when the eligibility package has been submitted in a timely manner with all required documents?
Make sure your CCS has a copy so that they can let us know so that we can coordinate with EDD. If we don't have a copy, it limits our ability to assist.
Okay. What is the telephone number, or where can we find the EVS IVR phone number?
So the link to this PowerPoint is the EVS user guide, which does contain the contact information. So definitely click on that link in order to obtain that information, please. And if you're having issues accessing that document, just send us an email and we'll send it to you.
We have a question regarding where can providers obtain the calendar for delegated nursing training?
That's on the DDA website.
Is it the training calendar,
It's the
John?
training calendar.
Okay, so if you go to the DDA website, I want to say on the left-hand panel, there's an option for the training calendar, if I'm remembering correctly, but that information should be on the training calendar.
And you have to check that frequently because the training gets often posted within 3 weeks of when the training starts.
Yeah.
Okay. Next question, is this meeting recorded, and if so, where can I find it?
Yes, the meeting is recorded. It will be on the DDA's YouTube channel. on playlist 2025. We should have it up there by tomorrow.
You. Next question, if an individual is out of the waiver due to the rep payee, which is family, not submitting financial statements, and the provider has not got paid in a year, but is still providing service, what options does the provider have?
To work with the CCS to initiate the waiver re-enrollment process. If the issue is specific to the rec payee just not wanting to provide documentation, the CCS can share that with us so that we can follow up with EDD to determine what the other options are.
Right, so definitely reach out to the regional office so we can help facilitate the re-enrollment process in order to allow that person to maintain their services as well as the provider to bill for rendered services.
Okay. The next question, if the agency completed a DA for staff in an investigation, how do I respond to a plan of correction related to that incident?
I think that's best to send the example along. You can feel free to send it to me, and I would include Mark Celeste.
And me is John Miller, so.
Oh, I'm sorry. That's john.miller1@maryland.gov.
Yes.
And then there's mark.celeste@maryland.gov. And we'd be glad to assist you with that. Mark's been doing that for years.
Yes.
Very helpful.
Okay, we did receive some suggestions and comments, and we will respond to those outside of this meeting. So that's all the questions.
Okay, well, thank you all very much. We appreciate all that you do in supporting our population. And if you have any questions, concerns, feel free to reach out to any of us, and we'll do our best to get back to you as quickly as possible. Thank you, and I hope you guys have a great rest of your day. Take care.